So the DEA has proposed new regulations on telemedicine prescribing of controlled substances. In the year 2023, what could this mean for patients with restless leg syndrome and other sleep conditions? I'm Dr. Andy Berkowski of ReLACS Health, and today I'm going to address docket number DEA 407, or what I think it's called. This is a very confusing document, and I'm no lawyer, so take what I say with a little bit of a grain of salt. But what this proposal is to put restrictions on telemedicine prescribing, so prescribing controlled substance medications without seeing a patient in person on physicians and other healthcare providers. This would allow the prescribing of Schedule 3 through 5 controlled substances for up to 30 days before a patient must be seen in person. It does not allow the prescribing of opioids through telemedicine without the patient being seen in person. So, what are the ways that a telemedicine provider can prescribe controlled substances then? Well, the DEA gives a couple of ways to do this. One, and probably the most common way, will be that another physician or provider with a DEA license must physically see the patient, examine the patient, and submit a referral to the telemedicine provider. And then the telemedicine provider can then later on provide a controlled substance prescription. Or the telemedicine provider actually has to be there via telemedicine at the same time that the patient is examined in person by another doctor. This is a tremendous barrier and a very regressive proposal to telemedicine care. We've made so many strides in telemedicine since the pandemic began and provided access to specialists of people who are disadvantaged, have transportation issues, people from rural communities, or simply people who can't find a specialist near where they live. And now the specialist can come into their home and provide medical care. So this puts a huge barrier to these patients in terms of getting potential treatments that they require for their medical conditions. So in my view, this is a potentially regressive and harmful to protect patients from the diversion of controlled substances. So the DEA is well intentioned, but have they gone overboard with this? So what is the benefit to an in-person visit from a medical standpoint? Well, in the field of sleep medicine, almost none. Almost every sleep condition, whether it's certain conditions where people have sleep studies or there are lab tests, most of it is based on symptoms of sleepiness or not being able to sleep or having restless legs. This all can be conveyed through a patient telling their symptoms to the doctor. There really is almost no role to an in-person examination that would change whether the doctor, the sleep physician, would prescribe a controlled substance. Almost all sleep conditions involve the prescription of controlled substances. People with insomnia, though cognitive and behavioral therapy is a first-line treatment, all prescription medications, or most of them, are predominantly Schedule 4 controlled substance, like benzodiazepine receptor agonists and benzodiazepines themselves, drugs like Ambien, Lunesta, Klonopin, and Ativan. For REM sleep behavior disorder and parasomnias, sleepwalking, most of those medications are controlled substances, mostly benzodiazepines, Schedule 4 drugs. For patients with narcolepsy and other forms of excessive daytime sleepiness, wake-promoting medications like Provigil, Nuvigil, or for narcolepsy, Xyrem, Xywav. These are Schedule 4, Schedule 3, and some need amphetamines to maintain alertness. That's a Schedule 2 drug. That cannot be done at all through telemedicine without an in-person visit first. So despite the fact that sleep patients really don't need a physical examination, they are not going to be able to get the treatments they need through telemedicine if this law were to be enacted. So as a member of the physician community, provider community, or the patient community, you can make public comments on this proposal. And what you need to think about is that there is a war on drugs. There is a rush of synthetic fentanyl coming across illegally into the United States. But restricting people from prescribing drugs like gabapentin and Lyrica through telemedicine, is that going to solve the opioid crisis in our country? Or is it going to more likely harm patients by preventing them from accessing the treatments that they need, particularly in my case for sleep conditions? So that's what I would like you to think about. Again, this video is for medical information only. It does not constitute the practice of medicine. Please make all medical decisions under the guidance of a medical professional. I also am not a medical lawyer or any type of lawyer, so please read this DEA proposal on your own and the interpretations of it by actual lawyers. And as always, one of the keys to sleeping well is to relax.